Hi everyone, I'm Dr. Aleksandra Brown. I'm a board certified dermatologist and welcome back to my channel. Today I wanted to talk about something that is so common in my clinic and affects every woman at some point, and that's menopause. That's a time when a big hormonal shift doesn't just change how you feel, but also changes how your skin behaves. And you might notice things like skin dullness, sensitivity, dryness, increased visible lines, or even breakouts. If you've never had pimple and now suddenly you have pimples, this can start happening for the first time in your 20s, and it can be all due to those hormonal imbalances and hormonal shifting as our body's learning how to adjust to it. So in this video, I want to walk you through what's really going to happen to your skin in menopause. I'm perimenopausal, so some of the stuff that I'm talking about today is just from my medical dermatology as a physician who treats skin, but some of it is from what I hear from my patients as well. I am perimenopausal. I'm not in menopause yet, but I'm starting to see some of the early signs of it, and boy, is it fun. Now, if you are perimenopausal and you want to know, like you're like me and you want to know what you're doing to your skin and what you need to be doing, and you want to know what I'm doing, I'm going to make sure I link up my perimenopause skincare video and things I've done in the last couple years to help adjust my skin to this hormonal shift that I've experienced. But if you've already hit menopause and you're like, I need more than just that video, let's talk about exactly what's happening to your skin during menopause, what ingredients do you need to look for to help avoid some of those things, and how to build really simple, effective skincare routine that's going to do the job and not be too expensive and really be like simple to incorporate in everyday life. So I don't want this to be overwhelming. If you have already seen my perimenopause skincare video, and I would encourage you to check that one out, watch this. And if you watch both of them, you're like, well, it's got to be more. I want more skincare, more products. I'm already using this. I will go ahead and below link up also my video for skincare in your 50s and 60s. Now that video starts with more of pricey things, like your growth factors, peptides, things like that. And they're great products and you should be using them at some point, but you need to be doing everything in this video today prior to starting that video. So the video today is really the basics of skincare in your menopause to make it simple, affordable, effective, and not overwhelming. Okay, now I hope you understand what this video is going to be about, and if you're interested, let's get into it. So during menopause, our estrogen levels drop, so skin starts producing less collagen. Now, some of the collagen is lost just from simply aging, but when estrogen drops, that collagen loss becomes exponential. We also lose things like elastin and then sebum or oil production. So that means your skin is going to be less firm. It's going to lose some of the hydration. It's going to lose that bounce that you had when you were like in your 30s. The cell turnover rate also decreases. So our cells turn over about every 28 days in our 20s, but as we get older, that slows down. So that means the skin becomes more dull. The brown spots become more pronounced. The collagen loss that is just normal as we age becomes accelerated during menopause. Some of the studies show that women lose up to 30% of their skin's collagen within the first 5 years after menopause. Also, your skin gets thinner and more fragile, so there's less collagen and elastin. That means there's weaker structures. So those fine lines become deeper, more pronounced. The skin sagging becomes a little more noticeable. Your oil production decreases, so skin often feels more on like a tight, dry, flaky side. And really important here is your barrier function weakens. So moisture escapes really easily, so irritation, redness become more common. Not only are you seeing more wrinkles, you might be jumping to like retinols and AHAs to help repair that, but because your barrier function is weakened, you're more likely to experience irritation from those products. You have to be really careful. And something that's really noticeable is that wound healing slows. So minor scratches that used to heal in like 7 days will now take twice as long, especially on lower extremities. So irritation, if you develop any irritation from any products, harsh products that you've used, or you have any minor scrapes, they're going to be a lot slower to heal. So the goal for skincare at this stage is going to be anything that's supporting skin through the change. So you want to work on rebuilding that barrier, replenishing the hydration, and also stimulating collagen production so those lines are not as visible. So let's talk about rebuilding collagen and elasticity. You want to support that dermal matrix, the network of the collagen and elastin that gives the skin its firmness and bounce. This is where ingredients like vitamin C, retinoids, and peptides come in. Let's talk about vitamin C briefly. I'm going to mention a couple of products. Vitamin C is like my step one in anti-aging after sunscreen. Of course, sunscreen is always number one. Vitamin C and retinol come in second right there. Vitamin C helps protect collagen degradation from UV light. It's the most potent antioxidant. My splurge recommendation here is the Skin Better Ultra Advanced Defense and Repair Serum. We actually carry this one in my clinic. I treat a lot of rosacea patients with pulse-dye laser, and rosacea patients tend to have very sensitive skin, so they can't use a lot of vitamin C's because they can be a little bit harsh, especially L-ascorbic acid. But this Skin Better Ultra Advanced is very gentle. This advanced serum offers that comprehensive antioxidant protection by defending the skin from both external environmental stressors, but also the internal oxidative damage. And unlike traditional vitamin C serums, this formula contains 19 powerful antioxidants, including vitamin C and E, but also has a proprietary botanical blend to help brighten the skin, reduce some of the redness, and improve overall skin texture. The key ingredients are the LLPQQ, the vitamin C, and specifically this one has the THD or tetrahexyl decyl ascorbate type of vitamin C, which is best for sensitive skin. There's also vitamin E, plankton extract, and micrococcus lysate, niacinamide, and licorice extract. Now, if this splurge category is not in your budget, I would recommend trying the Naturium Vitamin C Complex Serum. This one delivers still pretty good brightening, antioxidant protection with a blend of multiple stabilized vitamin C derivatives. This makes it gentler than like the pure L-ascorbic acid, but still effective. It can help even out some of the dullness, uneven skin tone, and support collagen production. It's ideal for that menopausal skin that lost some of its glow. It's really good for everyday antioxidant option for that really sensitive or redness-prone skin that can't tolerate like high vitamin C or specifically cannot tolerate the L-ascorbic acid type of serum. The key ingredient in Naturium is the stable L-ascorbic acid and then also the sodium ascorbyl phosphate, which is the best one for like the most sensitive skin. It also contains the glycerin bioactive fruit complex, which is derived from like mango, papaya, and pineapple. Your vitamin C alone is not going to be enough to help rebuild that collagen. You're going to need the GOAT, and that is your retinoids. Retinoids are really ideal for wrinkle reduction. They work in a couple different ways. They help eliminate the top layer of the skin cells, so they increase the cell turnover, so it's going to help with that dull skin, with the brown spots that remain on the skin as we hit our perimenopause and menopause. But after 8 to 12 weeks of consistent use, retinoids have been clinically shown to boost collagen production and improve skin texture over time. So let me give you a couple options here. The first one is the splurge category. This is the Aven Retrinol 0.1% intensive cream. This has the retinaldehyde, which is the next generation of vitamin A. That's one conversion step from retinoic acid, which is the actual tretinoin. So you have retinol, retinol, retinoic acid, or tretinoin. So you get results that are just a little bit faster than your average retinol, but the irritation is less compared to your tretinoin. Retinol is clinically shown to reduce fine lines, improve the skin texture, and enhance the radiance in as little as 4 weeks. This one in particular is encapsulated for the gradual release to minimize the irritation, so it's ideal for that mature or menopausal skin. It comes in several different strengths, so you can start with the lower one, use it, always start with like 3 nights a week with any retinol, and if you're not irritated, go up to like 5 nights a week, and you're using it, let's say, every single night. Next time you're due for a refill, get the higher strength. Another pro tip, if your skin is so sensitive that you apply this retinol and it irritates your skin, consider applying like a light moisturizer or hydrating toner. Turtur happens to be one of my favorite ones. It's such a lightweight layer underneath that just helps balance out some of the dryness and irritation, and your retinol still works. The key ingredients here are the retinaldehyde, the hyaluronic acid, the glycerin, and vitamin E. But let's say you want to save on your retinol, which is a perfectly good option. I'm going to give you my favorite here, and that's the Rock Retinol Correction Deep Wrinkle Night Cream. This is formulated with that pure retinol. It works overnight to reduce the fine lines, wrinkles, and it really is, Rock is the gold standard for retinol. It has been studied for decades. This particular product is a non-greasy, really hydrating formula, making it really great starter for mature skin. It's clinically proven to show visible improvement in 12 weeks. The key ingredients are the gold standard Rock Retinol and squalene, which will help minimize some of the irritation. But if you're somebody with super tolerant skin, you've used the rock, you've used retinaldehyde, you've used every retinol over the counter, and you use it every single night, and you put it directly on clean skin with no moisturizer underneath, it could be time to talk to your doctor about switching to a prescription type of formula like tretinoin. Tretinoin is retinoic acid, so it is the most potent formula of retinol, but it's also the most irritating. So this is only really indicated for skin types that can tolerate it. The advantage to switching to tretinoin is that the results are going to be a little bit faster, a little more significant because it's directly converted. It is the retinoic acid, so you don't have to have all those conversion steps. So you're going to have faster results, but it could be at a price of irritation if you're somebody with sensitive skin. So just be careful with this one. Now let's talk about the category of restoring the barrier and replenishing those lipids, because this is really what's the most important in this age group. You hit this age, and if you don't have all the barrier repair mechanism in place that you need, all those actives are just not going to work. When estrogen levels drops, the skin ceramide and cholesterol levels plummet, so that's why even thick creams may not feel like they're enough. You need to have barrier repairing formulations that are going to almost like mimic your skin's natural lipids. And let me give you a couple recommendations here. The first one is a splurge, but it is so good. This is the SkinCeuticals Triple Lipid Restore 242. This one replenishes essential skin lipids like ceramides, your cholesterol, and your fatty acids in the exact proportions that are in your skin. It has that optimal ratio to restore the healthy barrier. It leaves your skin really nice and plump and smooth and nourished. It just feels heavenly on your skin. The key ingredients are 2% ceramides, 4% cholesterol, and 2% fatty acids. Now, if you're like, well, I need to save on my moisturizer, I'm with you. Let me give you a save option. The save option here is the Burst Daily Recover Rich Barrier Cream. This is really rich and non-greasy moisturizer. It's designed to help strengthen the skin barrier and restore hydration. It's really nice. It feels just heavenly on your skin. It's packed with ceramides and fatty acids to help replenish what's lost with age or with retinoid use. It helps reduce redness and tightness, making it really good for like dry, sensitive, or retinol-treated skin. The key ingredients here are the 7-lipid complex, including the 0.05% ceramide NP and 5% squalene, as well as niacinamide glycerin and adenosine. Now, another product that maybe you thought I was going to talk about and I haven't mentioned, here it is. Do you need to be using topical estrogen creams? This is a question that I've been getting quite frequently in my clinic for like the past 2 or 3 years. I get a lot from my peri and postmenopausal patients, and they want to know, do I need to put my estrogen cream on the face? How often? How do I incorporate it in my skincare? And if so, which estrogen cream do I get? So if you're somebody who's interested in estrogen cream, let me below link up the one that I posted last year. It's kind of like a general guideline, but I'm going to tell you this. Since I posted that video, I have personally been testing 3 estrogen creams. One's the estradiol, which is your downtown estrogen cream. There's pluses and minuses to it. We can discuss that. And then I have 2 other ones. One is from a big brand, 0.3% estriol cream, and also had my local pharmacy compound the 0.3 estriol cream. And they're all just a little bit different. And my answer to do you need to be using estrogen cream is that's between you and your doctor, I guess. But do these creams make a difference? I'm here to tell you that yes, they do, but they're really not for everyone. So you want to make sure you get a consultation with your dermatologist. If you're somebody with a history of cancers, they're estrogen driven. That's like a big topic to discuss with your gyne and your oncologist. But topical estrogen creams like estriol and estradiol, they're prescription, first of all, and they can be used under medical supervision to help improve the skin elasticity, the hydration, and that barrier strength. And they really complement all the other ingredients that we talked about today in a really nice way, in a way that none of the other ones actually do. So research shows that these creams can boost collagen and hyaluronic acid levels. They can help restore some of the firmness and thickness that's lost during menopause. Estriol is the gentler option with less systemic absorption, while estradiol is the stronger one, and it can lead to maybe potentially more visible changes, but you kind of have to think about it. If you're doing your estradiol cream in your genital area because you're trying to get a systemic absorption, are you going to get that systemic absorption from putting it on your face? That needs to be discussed. So I've been testing about 3 of these for, probably 4 months now. I would love to make that video for you guys. So if this is something that you're interested in and you want to know who's a candidate, who's not, like a general, of course, picture, it wouldn't be individualized, let me know down below if you want something on estrogen cream. And also make sure you like this video and subscribe to the channel, so if we do end up doing this video, you can get notification and watch it. And as always, make sure you comment down below if you have other topic ideas. So today you guys learned that menopause can completely change your skin, but it's not all downhill, okay? Like, there's things you can use to help slow this down. If you have the right components of like barrier support, collagen stimulation, and hydration, you can 100% maintain really strong, resilient, glowing skin. So if you found this video helpful, make sure you hit that like button, subscribe to the channel, comment below if you want that estrogen video. You can always find me on Instagram and TikTok at Dr. Aleksandra Brown for shorter, fun content. Thanks for watching again. I'll see you next time.